Thanks for joining us for KSAT News at 9, streaming from right here in the KSAT 12 newsroom. I'm Steve Spriester. Coming up tonight, we're taking a closer look at how COVID-19 can impact the heart. We'll also be joined by Dr. Ruth Berggren, who will be Skyping with us live to answer your questions. Dr. Berggren, an infectious disease expert and a member of the new team tasked with developing a plan to move the city and county out of the social distancing phase. Plus, we're going to meet Comal County's new epidemiologist. But first, a look at the numbers. An additional 51 confirmed COVID-19 cases reported in Bexar County, bringing our total to 1,080. 82 people remain hospitalized tonight. 41 are in intensive care. 24 people are on ventilators. For the second day in a row, no additional deaths were reported. That's good news. 325 people have now recovered. Even as the number of confirmed COVID-19 cases continues to go up in our area, many people are asking, when will our economy reopen? And while we're not ready to go back to normal just yet, the city and county announced a team this evening that will help us prepare for when that happens. Mayor Ron Nirenberg says there are 20 committee members on the new economic transition team representing different sectors of our local economy. The first step to get us out of this social distancing phase is to get the guidance of medical experts. That's in the hands of the city and county COVID-19 transition team that was announced last week. The mayor says a rough draft of their plan is expected by Friday.
An economic transition team will then review that data and help formulate best practices as well as some sector-specific guidelines based on how businesses can ensure that they can operate when it's safe to open, but in a manner that protects themselves, their employees, as well as their customers.
Among the members of the new economic transition team, the president of Toyota Motor Manufacturing Texas and the president of Tejas Premier Building Contractor, Inc. It's worth noting that Texas Governor Greg Abbott has also put together a team of business executives, a task force to reopen the state's economy. So far, Abbott has reopened state parks, eased restrictions on some surgeries, and on Friday, retail stores will be allowed to operate curbside and drive-through. More announcements for this phased reopening are expected to be announced next Monday. A big question right now is how the state's timeline and process for reopening will actually impact the city and counties. And of course, what health experts have been saying is we can't reopen until we have adequate testing. So what is the status of testing here in San Antonio? Just like other cities across the country, our local leaders have expressed frustration at the lack of widespread testing. San Antonio's Metro Health is pushing for an increase in testing sites, even speaking with the Texas National Guard for more testing. And if things go as planned, the Texas National Guard could provide 3 more drive-through testing sites in Bexar County. When it comes to considering where the next testing site should be, the city's health department says access or having a number of, and Metro Health Director Don Emmerich says they want to add testing where there are high levels of uninsured people. She says oftentimes people with underlying health conditions are often found in these areas with higher uninsured rates.
And so hypertension and diabetes are the leading causes of comorbidities in all of our deaths in Bexar County. And so we want to make sure that we target that.
Right now, we know San Antonio is getting a second drive-through testing site. All that we know right now is it is a Texas Med Clinic on the city's south side. We've also learned a Walmart on the west side preparing to become a new testing site. COVID-19 has been perceived as mainly a respiratory illness, attacking the lungs. But research is now showing 1/5 of patients are experiencing severe heart damage. More concerning, many of these patients have not had underlying heart problems before. A team at UT Health San Antonio trying to figure out why some people's hearts are affected and others aren't. Courtney Friedman breaks down this important study.
It's already been clear to scientists and doctors that people with underlying heart issues who get COVID-19 have poor recovery outcomes. But what about the people infected who have never had heart problems and suddenly develop them?
They had elevations of blood enzyme markers that were consistent with a heart attack, even though they didn't have any blockages in their coronary arteries. They had heart rhythm disturbances, and that this occurred with quite high prevalence.
UT Health San Antonio Chief of Cardiology, Dr. Alan Anderson, says 20, sometimes up to 30% of patients are displaying these reactions. So researchers there have set up a long-term study to find out why this is happening and how to possibly stop it.
We see patients who have likely had viral infections that they didn't even recognize, and yet they manifest with heart failure symptoms months or years later. So there could be a long-term implication to the health of patients who have been affected by COVID-19.
The study involves two drugs, one an antibiotic and the other a diabetes medication. Researchers believe both have the potential to block the virus from infecting heart cells. They're looking at isolated muscle cells in the lab right now, and if all goes well, they'll begin doing clinical trials with patients who have recovered from COVID-19. Depending on the outcome, they could track those patients for 10 to 15 years. For the 9, Courtney Friedman.
Dr. Anderson also said these patients are very prone to developing blood clots. He said that's been seen a lot in North America, blood clots in the legs, in the lungs, and possibly even in the smallest microscopic blood vessels. They're going to be studying that reaction as well. Let's take a look now at the COVID-19 cases in our surrounding counties. Multiple counties are reporting an increase in cases tonight, including Hayes, Guadalupe, and Wilson counties. They are now reporting 137, 63, and 23 cases respectively. Comal County also reporting an increase tonight with 45 confirmed positive cases. 6 COVID-19 related deaths have been confirmed in Comal County. In response to the pandemic, Comal County has brought in an epidemiologist to help track cases. That's someone who studies diseases. Tiffany Huertas spoke to the county's new hire about what it's been like to start the new job in the midst of this health crisis.
Everybody that has an active infection, we contact them every day. Everybody who has household members, after their period of quarantine is over, we follow up with those household members every day for 2 weeks following.
Since joining Comal County last week, Connie Alanis has been making calls and investigating coronavirus cases. She says her position, which is funded through a state grant program, helps take some of the burden off of the health department.
So people that work in immunizations and other departments are having to focus solely on COVID right now.
Alanis came out of retirement to take the position as Comal County's epidemiologist. Previously, she worked for the state.
I tracked H1N1 hospitalizations, ICU admissions, and fatalities for 28 counties.
She says when they get a report of a positive COVID-19 patient, they contact that patient and ask them several questions.
What was the first day you got sick? And were you around anyone else who was sick? And then we go back a couple of days because we know people are actually infectious before they show symptoms.
She says they are requesting quarantine for anyone with extended exposure to a person who has tested positive during that person's infectious period. Alanis says when they talk to people, she hopes to also educate them along the way.
The importance of social distancing, of wearing a mask, stopping the disease process from continuing.
Alanis says on average, 2 to 5 new cases are reported daily in Comal County. For the 9, Tiffany Huertas.
Let's zoom out now and look at the Department of State Health Services. It's showing more than 20,000 cases in Texas, 517 deaths. In the United States right now, there are 824,000 cases and 45,000 deaths. And around the world, Johns Hopkins University is showing 2.5 million cases and 177,000 deaths. Let's turn to tonight's 9 at 9 now. The search has been suspended for 7 boaters who disappeared in Baytown. A new study shows almost half of the United States population is breathing heavily polluted air. Plus, a look at how COVID-19 is impacting communities across the world. Here's tonight's 9 at 9. In Baytown, Texas, the Coast Guard has suspended a search for 7 people who were reported missing in Cedar Bayou. The Coast Guard says they got the Mayday call just after 9:30 last night from a distressed boater, saying their 27-foot vessel was taking on water. After that call, though, they lost radio communication. They say there were 3 children and 4 adults on board. San Antonio getting a second drive-through testing site, this one on the city's south side. SA Metro Health says it's going to be at the Texas Med Clinic that was converted from a bank and has drive-through capabilities. The site will be open on Thursday. Appointments will be required. The Dutch Prime Minister announced today that it will extend its lockdown for most businesses until May 20th. Large gatherings will be banned until September 1st. However, primary schools are allowed to slowly open, with students returning to schools in a staggered pattern beginning on May 11. The Prime Minister emphasized that the degree of uncertainty surrounding the virus is still too great to allow businesses that would require close contact to reopen. Almost half of the U.S. population breathing unhealthy, heavily polluted air. That's according to a new American Lung Association report. According to that report, U.S. air quality is dramatically declining. The roughly 150 million people breathing dirty air is nearly 21 million more than in last year's report. Here at home, the San Antonio Fire Station, where 6 firefighters tested positive for COVID-19, will remain closed until the quarantine period is over for 41 of its personnel. Fire Station 14, located on Thousand Oaks near Henderson Pass, has been deep cleaned professionally and other station maintenance issues. Those who are healthy and normally work out of Station 14 have been temporarily deployed to other fire stations. The National Park Service says a vandal who left graffiti around Death Valley National Park on a number of occasions has confessed and apologized. He wrote Steve and Lacey on rocks, a well, and other historic structures throughout the park in January of 2019 and January of 2020. The Canadian man called to confess and apologize on April 17th. It was just days after the Park Service shared images of the vandalism on social media to try to identify the culprit. A new study has found that ancient crocodiles once lived in the oceans much like whales and dolphins. A new study examined fossils and found that these animals moved from land to sea about 182 million years ago. They likely had similar skin and body shapes to modern dolphins, but unlike dolphins, scientists believe they breathe through their noses instead of blowholes. The Corpus Christi emergency room doctor has moved into his kid's treehouse to help keep his family safe. He was concerned about potential exposure to COVID-19, so he began brainstorming potential quarantine accommodations. He considered renting an RV or hotel room until his wife suggested their kid's treehouse. The treehouse is equipped with food, a bed, and even has air conditioning.
Quarantine is serious. It's the only way we're going to beat this thing.
A hospital in Long Island discharged its 750th COVID-19 patient today. That's an impressive milestone when you consider NYU Winthrop only has 511 beds. The patient released today is a teacher from Brooklyn. She expressed gratitude to her healthcare providers as they cheered for her on her way out.
The staff is phenomenal. Thank you very much, staff.
To read more about these stories, head to KSAT.com.
Hey everyone, meteorologist Sarah Spivey here. I hope you're staying safe and at home. But the next couple of days, the weather's going to be pretty nice outside. In fact, there's not going to be a significant chance for rain except for tomorrow. Tomorrow there is going to be a small chance for storms in San Antonio, but really the better chance for rainfall and storms will be across areas in northern Texas like the Dallas-Fort Worth area. But first, let's go ahead and talk about how the day was today. Today, pretty nice outside. A little bit on the warm side, but we did see a break in that cloud cover in the afternoon, and we were able to reach a high temperature near 90 degrees, 88, but we didn't quite reach 90. You know, it's been warm the last couple of days with highs in the 90s, not necessarily the case today because we did start off with some cloud cover, but again, we saw some clearing here in San Antonio. But storm chances are going to increase for a good chunk of Texas, not necessarily San Antonio, but especially in northern Texas, all because of this low pressure system, which is over the Four Corners region right now. In fact, you can see some shower activity around that low pressure system. Now, this low pressure system, it's going to move east, and it's going to move across kind of the Oklahoma and Texas area, and that's where it's going to bring the potential for some strong storms. You can see here that I've overlaid the Storm Prediction Center's outlook for severe weather, and you can see where that bullseye for severe weather is. Again, southeastern Oklahoma, northeastern Texas, and parts of eastern Texas, even as far south as Austin. But again, here in San Antonio, we're likely gonna stay pretty much in the clear. We're likely gonna be skirted with low chance for some thunderstorms. You can see on the futurecast that tomorrow in the midday hours from about 10 o'clock in the morning through about 2 p.m. That's our window of opportunity to see storms in San Antonio. It's not that great, only about 30%. But because of the time of year, if we do see a storm pop up, it could become strong. We'll of course keep you informed, but as you can see on the Futurecast, after about the early afternoon, our rain chances are really going to go away, and we're going to clear out and actually have a pretty nice evening. But here's the 411 for tomorrow. Again, cloudy to start the day, right at about 70 degrees, 30% chance for storms in the middle of the day. Then in the afternoon, still mostly cloudy, but a high near 85, and then our rain chances are really going to go away, and we'll be looking at a pretty comfortable evening. Winds from the south at 10 to 15 miles per hour. But it's going to be pretty warm after tomorrow. In fact, we'll climb up to the mid-90s by Friday, but a pretty weak cool front is going to move through by the weekend, and that should allow for temperatures to go back down into the 80s for highs and into next week as well. What's even greater is that we're going to stay with low humidity after tomorrow through the weekend. So low humidity Saturday, Sunday, and a high only in the low 80s. That's going to feel pretty great. Humidity will work its way back in by Tuesday of next week, but all in all, a quiet forecast except for that potential for isolated storms tomorrow. We'll keep you informed. Hope you have a great evening.
Your questions for an infectious disease doctor up next. We continue our effort tonight to fight fear with facts as the coronavirus pandemic continues to impact communities across the globe. Infectious disease expert Dr. Ruth Bergeron from UT Health San Antonio is back with us this week to help us get answers to our coronavirus questions. Thank you, Dr. Bergeron, for being with us as you are every Tuesday. I appreciate it.
Good evening.
So I know that you're part of the city-county health transition team, and the first question has to do with that. Your first meeting was today, I believe. A rough draft of the plan to get us out of social distancing is supposed to be Friday. What can you tell us? I mean, I know you're probably in the very early stages of this whole thing, but what can you tell us right now?
So tonight was actually our second meeting. We did have a meeting over the weekend. And first of all, it's an incredibly great group of people that I am privileged to be a part of. You know, we've got health experts that include infectious disease doctors like me, but we have hospital leaders, we have epidemiologists, we have ethicists, and all sorts of public health experts. We also have representation, as you might expect, from Metro Health, but also from University Health System and other UT Health is there, and a lot of other organizations. So it's a good group of people. What we've been able to agree upon so far is guiding principles. Those are really, really important and probably worth sharing a little bit if I could. Yeah. It's really important to state at the outset that we strongly believe that human health and economic well-being are tightly linked, and we prioritize human life in the face of this pandemic, recognizing the necessity of strengthening our community's economic well-being at the same time. And we know that continued and severe economic hardship undermines the health of a community just as much as disease. So we value working hard, caring for people across generations, protecting those who are medically at risk, ensuring that no one is left behind. And these are the shared values that we believe will guide a transition towards economic recovery, and an economic recovery that's balanced by preserving the safety and the integrity of our community.
Yeah, it's a balancing act is really what it is when you're talking about the health transition team. And then we've got the economic transition team as well. All right, let's get to some of our viewer questions. The first one is, sometimes people who have COVID die from other issues. What determines if a death is considered COVID-19 related?
So excellent question. And at the end of the day, that will possibly leave some people scratching their heads because there can be cases where it's nuanced, right? But just to make this question very plain to everybody, if I have mild COVID, I go out and get into a car accident and I die while I have COVID, we wouldn't call that a COVID-related death. although I had COVID when I died.
Yeah.
So that's kind of a simple case where it's very obvious. Others are more nuanced because, Steve, the folks who die with COVID are often those who have serious underlying conditions, heart conditions, lung conditions, diabetes, high blood pressure, congestive heart failure. And so if you see a worsening of one of those conditions in the setting of really severe COVID, there could be multiple factors at play in a person's death. But I think if, it's a matter of degree. If the person was really sick with COVID and they had other diseases too, and then they die, it's probably a COVID-related death.
Yeah, very well put. All right, is there a plan in the event that positive cases go up due to opening businesses too soon?
Yeah, so that's the sort of thing that our transition team is developing guidance for, just exactly that. And I think the public should be prepared to realize that there may be a cyclical nature to this reentry into the new normal. That as we monitor and evaluate the outcome of our plan, we're going to have to recognize that if cases are going up in a certain sector, we're going to have to pull back within that sector and impose more strict behaviors, more strict restrictions, as it were. So that is what we're working on right now. What are the triggers? What are the indicators? How do we know when we can move forward and when we need to pull back?
Yeah, there has to be flexibility built in.
Yes, and people need to be prepared for that, and don't believe that we somehow erred if there has to be a pullback. That's the nature of infectious disease, and it's the nature of trying to make predictions.
Yeah. All right, next question. As an essential employee, if I don't feel well and I have a temperature, should I get a test? I'm guessing she means a COVID-19 test before going back to work.
Yeah, so the first thing I'd recommend is if you've got a fever, please go to the sanantonio.gov website, fill out the online questionnaire, and get guidance. It's very likely that that guidance will tell you to go and get a test. And then ultimately, when you come back to work is something that should be determined in consultation with a physician and also your work supervisor.
All right, the final question is, what has to happen for things to get back to normal?
Well, that's an important part of the plan that we're working on. We'll have a draft of this plan ready to submit to the city council and the county commissioner court by the end of the week. And we will have questions and feedback from them, and then ultimately a plan that we share with the public in the following week.
Is there anything you're seeing out there that's concerning you right now?
Well, I'm concerned that people are so excited about the antibody testing, and I feel like there's some jumping of the gun that's going on because we have yet to learn which antibody tests are really reliable and whether or not a positive antibody test truly correlates with being immune. And we wouldn't want to jump the gun and start making decisions about putting people into the workforce based on antibody tests until we have greater clarity about that. So it's a balancing act. It's an area that we're all following really closely.
Yeah, and even I saw a study today about hydrochloroquine that there's some questions about whether it's really effective when it comes to COVID-19 today.
Yes,
a new study.
The data there are looking kind of discouraging, and we're worried that there could be an awful lot of side effects to no good purpose. So we'll be waiting and watching on the studies that come out, but we are backing away from that because it's less clear that is really helping. Another area, though, that I am worried about is all the folks who haven't been taking care of their health during this COVID shutdown. And we worry that folks who've had to put off doctor's appointments may be suffering worsening of their underlying diseases. Folks who are diabetic, not monitoring their blood sugars, suffering from injuries that they don't get tended to, and then wind up having an infection, a diabetic foot ulcer, and so on. And there could be, we fear, waves of people that are sicker than they normally would be because they haven't been tending to their health. So what do we do about that, folks? Your doctors are at work. We're doing primary care through telehealth. Follow through, take care of yourselves, see your doctor, and try to be as healthy as you can be.
Yeah, absolutely. Good advice. All right, I always like to give you the last word. And you always give us a little nugget to take with us of the many nuggets that you give us. So I'm giving you the last word tonight.
Well, I was worried a month ago that at this moment we'd be having a terrible time, drowning in the emergency room and having to make dire decisions. And that is not the case. So congratulations to San Antonio. This has been an incredibly effective flattening of the curve. I don't mean to dismiss any of the cases that we had. There's been suffering, there's been death, but my goodness, we're seeing so much less than we thought we were going to see. And that is the result of this community working together, coming together as a team, paying attention, and really valuing human life. So that is heartening. Now we're entering a new phase. It's really something to celebrate. I'm so excited that I get to be on something called a transition team. That's fantastic. But we need people's patience and forbearance, and we have to continue to work together, be patient with each other as we move forward and move forward safely.
Dr. Ruth Bergeron with the Long School of Medicine at UT Health San Antonio. Thank you for your time as always.
Happy to be here.
We'll be right back. Thank you, Doctor. Appreciate